Hi, I'm Angie Fabian, Chief Marketing Development Officer for Summit Healthcare's. We're going to do a weekly update on the COVID-19 pandemic that we have going on here in the United States and especially here in our White Mountain communities. So I'm going to have these lovely guests introduce themselves. Diana?
I'm Diana Anderson. I'm the infection preventionist for Summit.
I'm Dr. Simran Galhotra. I'm a lung doctor, etc., also a critical care doctor, and I'm the, among other things, I'm the medical director of the intensive care unit. So I take care of most of the patients in the ICU.
Welcome.
Thank you.
Thank you. Okay, so I'm going to be asking you all some questions. So I'm going to start with Diana. Can you please give us an update of where we're at? Or do we have any cases? What is the status of Summit?
We still do not have any positive cases. I have about 28 cases pending that I'm waiting for lab results, but as of right this moment, there are no positive cases.
Okay, good. Dr. Galhotra, some of the community is asking questions about ventilators. Is somebody equipped to handle patients in case we need, with ventilators in case we need them?
Certainly. We have approximately a dozen ventilators that are available immediately to use for patients who might require ventilatory support. But we have another dozen or so pieces of equipment that can be pressed into service very quickly if necessary. So roughly we have about 2 dozen or so machines that can support patients who need it. But what we know from the Chinese and Italian as well as New York, Seattle experience is that not everybody who has clinical disease with COVID-19 actually needs a ventilator. We need to remind ourselves that 80% of cases are fairly mild. About 20% of cases will require more medical attention, such as being in the hospital, requiring a little bit of extra oxygen. Less than 10% will need to be on the ventilator. There are other things like vapotherm that we can use, high flow humidified nasal cannula oxygen for certain patients, but we have this capacity of at least 24 or so machines that can be used for those very critically ill patients who essentially have what's called ARDS. We know a lot, we've learned a lot across the world in the last 30 years how to treat ARDS. So if a patient is really that sick, we have all the protocols in place to take care of them. The question is how many will we be asked to serve? So if the estimate is that 10% or less of the cases will end up in the ICU on ventilators, then, if there are 250 or so cases in the community, then that's what we might expect. But it's all very speculative. We have not yet had a case yet, as Diana just mentioned. We're definitely prepared for it. I plan to be in the intensive care unit 7 days at a stretch and alternating with my colleagues. So we are well covered if necessary.
Great, thank you. Diana, a lot of the community wants to know, should they come in and get tested?
No. And that's the simple answer. The only people we're testing are people that have clinical symptoms, significant clinical symptoms. In other words, they have a fever greater than 100.4 or 38 degrees Celsius. They have a dry cough or a wet cough. They have chest pain, chest congestion. Anything other than that, sniffles, etc. We're not testing people with mild symptoms. We are recommending folks, if you think you have it, just stay home.
Self-quarantine.
Self-quarantine, right.
And I'm sorry.
No, go ahead.
Self-quarantine certainly is appropriate. If you have more symptoms, like you're coughing up blood or are very short of breath, then clearly you need to get more medical attention.
Okay, good.
Right. Those are the folks that we recommend either calling your doctor or coming directly to the emergency department. If you're having trouble breathing, you need to be seen right away.
And by the way, I also see patients in the outpatient setting for sleep and pulmonary lung issues, and we're not, I'll be honest with you, I'm not in my clinic equipped to take care of you if you come with those severe symptoms. It's best for you to go to the emergency department at that point, because you're only going to delay your care.
Okay, good. Well, is there anything else either of you would like to add?
I think all the Centers for Disease Control recommendations that have been publicized over the last few weeks are correct. I think we should have physical separation. I prefer that term to social distancing, because stay away from other people, 6 feet apart, etc. But we live in a rural area, so the population density isn't that high. So feel free to go out and take a walk. Don't go in huge groups or anything. That's good for your mental health and your physical well-being. So, wash your hands frequently, as Diana has said in these podcasts. Don't touch your face until if you've gone outside to get groceries. You come home, wash your hands, and wipe down surfaces in the house. Anything else, Diana?
Well, I'd like to address the young people, because a lot of young folks that I know are saying, oh, if I get corona, I get corona. Not a big deal, because it doesn't really affect young people. But it does. And there are a lot of young people that have gotten sick from it. I see a lot of public service ads saying, do you really want to give it to your grandmother? Well, do you really want to have it yourself? A 17-year-old died in California yesterday. So if a 17-year-old can die from COVID, so can other young people. We just want everybody to be safe, be careful. Don't think that you're immune just because you're young.
Yeah, I'll add to that. The Italian experience is that a good fraction of the patients who died, yes, the majority of them were 80 plus, 80 years old or more, but there was a group between 41 to 60 who got very sick and died from it as well. So.
Okay, good. Good, thank you. That's a lot of information, but I have some more information for you all, for the community. As you know, Summit Healthcare has put restrictions in place on the entire campus and all the outpatient clinics. We are asking there are 4 exceptions to the visitors policy. That is, pediatric patients under the age of 18 can have 1 adult visitor per day. Along with laboring mothers, we ask that only 1 adult visitor per day. Special needs patients, which includes dementia or visually or hearing impaired patients, may have 1 support person with them per day, and surgical patients may have 1 support person with them. We are also changing our hospital visiting hours to 6 a.m. to 6 p.m. daily, and we have a few exceptions, as you know, for laboring patients and pediatric patients. And as mentioned above with the exceptions, when we say 1 support person per day, we are asking that repeated entry and exit is discouraged for the safety of the patient and the support person to bring in and take COVID-19. So we ask that you not continuously come and go. As of today, the Administrative Services Building, where you can obtain your medical records or pay your bill, will be closed to visitors. If you need a copy of your medical records, you can call 928-537-6326 during regular business hours, Monday through Friday, 8 to 5. If you would like to pay your bill or make arrangements to pay your bill, you can call 928-537-6911 during regular business hours, Monday through Friday, 8 to 4:30. You can also pay your bill online by going to summithealthcare.net and click on Pay My Bill, and you can pay your bill online. These restrictions will be posted on the internet later in a little bit here, and we want you all to stay safe and stay home if possible. As Dr. Geholter and Diana both mentioned, don't go in large groups. This COVID-19 is serious and can affect any age.
True, yeah.
And so we want our community to be safe. I would also like to thank all the community who has come together to make masks for community. We are having them dropped off here at Summit, and we will hand them out to community members as needed. So we thank you for that huge donation from the community. Thank you.
Yes.
And that's all I have to say. This is Angie Fabian.